Have you ever experienced sudden, intense pain in one of your joints, making it feel hot and incredibly tender? It is a disruptive and often alarming sensation, leaving many to wonder about its cause. While there are many reasons for joint discomfort, one possibility that often gets overlooked is gout. Yes, knee pain can absolutely be a sign of gout. Although gout is most commonly associated with the big toe, it can affect any joint in the body, and the knee is one of the more frequent sites beyond the feet. The reason gout can strike the knee, or any joint, lies in the buildup of uric acid in the body. When uric acid levels become too high, it can form sharp, needle-like crystals. These crystals then deposit in the joints, triggering a powerful inflammatory response. This inflammation is what causes the characteristic sudden, severe pain, swelling, redness, and warmth associated with a gout flare-up. While the big toe is often the first affected due to its lower temperature, other joints like the ankles, wrists, fingers, and yes, the knees, are also common targets for these crystal deposits. To determine if your knee pain might be gout, pay attention to the specific symptoms. Gout attacks typically come on very suddenly, often overnight, reaching their peak intensity within 12 to 24 hours. The affected knee will likely be very swollen, red, and warm to the touch, and even the slightest pressure or movement can be excruciating. Unlike some other forms of arthritis, gout usually affects only one joint at a time. If you suspect gout, it is crucial to consult a doctor, who can perform a physical examination and may order blood tests to check uric acid levels, or even analyze joint fluid for the presence of uric acid crystals. A key characteristic that often distinguishes gout from other forms of knee pain, such as an injury or osteoarthritis, is its dramatic and rapid onset, followed by periods of complete remission between attacks. The pain is not a dull ache that gradually worsens, but rather a sudden, overwhelming intensity that can wake you from sleep. Furthermore, gout pain can be so severe that even the weight of a bedsheet can be unbearable, which is a classic symptom often described by those experiencing an attack. Understanding that gout can manifest in the knee is important because early diagnosis and proper management of uric acid levels are key to preventing future attacks and protecting your joints from long-term damage. So, if you are experiencing sudden, severe knee pain with redness and swelling, do not ignore it. Seek medical advice to get an accurate diagnosis and start an effective treatment plan to manage your gout.